Super Agers. This video is based on key insights from the book Super Agers by Eric Topol. Chapter 1, A Tale of Two Patients. Eric Topol begins by illustrating two very different paths of aging through the stories of Mrs. L.R. and Mr. R.P., both 98 years old. Mrs. L.R. represents healthy aging, a life largely free from disease, even with a family history suggesting otherwise. She maintained a vibrant life through social connections and rediscovering passions after loss. Mr. R.P., in contrast, faced significant heart problems throughout his life, but benefited from decades of medical advancements like bypass surgery and stents, showcasing how medicine can extend life even in the face of illness. These contrasting cases set the stage for Topol's central argument. We are entering an era where extending health span, the years lived in good health, is becoming increasingly possible. Topol explains that for a long time, we've known lifestyle choices like diet, exercise, and sleep matter for health. But he introduces the idea of lifestyle plus, which goes beyond the basics. This includes things like spending time in nature, avoiding pollution, having strong social connections, and even how we exercise, focusing on strength as well as cardio. He emphasizes that small details within these areas can make a big difference. For example, instead of just saying, eat healthy, Lifestyle Plus encourages precision dieting, like time-restricted eating, where you eat all your meals within a specific window of time. The author then dives into the incredible world happening inside our bodies at the cellular level. Scientists are now able to study the 37 trillion cells in our body in amazing detail, looking at their genetic makeup and how they work. This allows for exciting possibilities like engineering immune cells to fight cancer more effectively, or even potentially growing new organs in a lab. He uses the example of taking cells from a patient, boosting their ability to fight cancer, and putting them back in a personalized approach to treatment. Topol highlights the importance of omics, which is a fancy way of describing all the different layers of biological information within our cells, like our DNA, RNA, proteins, and even the community of microbes living in our gut. By studying these layers, doctors can get a much more complete picture of an individual's health risks and tailor treatments accordingly. For instance, a simple blood test can now detect tiny pieces of tumor DNA, allowing doctors to diagnose cancer earlier. Or, analyzing proteins in the blood can give clues about how well our organs are aging. Artificial intelligence, AI, is also playing a growing role, according to Topol. AI can analyze huge amounts of data, medical records, lab results, genetic information, and even environmental factors to predict a person's risk of developing certain diseases. He points to initiatives like Thrive AI Health, which aim to create virtual health coaches that provide personalized advice and support. Imagine an AI that can look at your lifestyle, genetics, and medical history, and tell you exactly what you need to do to stay healthy. Finally, Topol discusses the rapid advancements in drugs and vaccines. He explains that AI is even helping scientists discover new drugs by predicting the shape of proteins, which is crucial for designing effective medications. He uses the example of Ozempic and Wegovy, drugs originally developed for diabetes, which have surprisingly shown benefits for weight loss, heart health, and other conditions. New technologies used to create COVID vaccines are now being applied to fight cancer and other diseases. Topol concludes by emphasizing that these 5 dimensions, lifestyle plus, cells, omics, AI, and drugs vaccines, aren't separate, but work together. Our lifestyle affects our cells and microbiome, our genes influence how we respond to drugs, and AI helps us make sense of all this complex information. He believes that these breakthroughs, built on decades of research, are changing our understanding of aging and opening up possibilities for a much healthier future. Chapter 2, It's in Your Genes. Eric Topol begins by sharing his long-held fascination with exceptionally healthy older people, like Mrs. L.R., who seemed to dodge disease. This led to the Welderly study, a 6-year project to find 1,400 people over 80 who had never been seriously ill. Topol and his team carefully looked at their DNA, hoping to find genetic secrets to their good health. Surprisingly, their genes didn't seem to be much different from everyone else's. The elderly weren't special because of their DNA, but because of how they lived. They were thinner, more active, better educated, and generally happier and more connected to others. Even some continued habits like smoking didn't seem to take away from their overall health. This discovery shifted Topol's thinking. Health wasn't just about genes, it was about lifestyle and other factors. Topol contrasts the elderly with what he calls the elderly. Most people who struggle with chronic diseases like diabetes, heart disease, cancer, and Alzheimer's. He emphasizes that simply living longer isn't the goal. It's about adding healthy years to life, a health span free from illness. He believes we're getting closer to achieving this, not by completely stopping aging, but by preventing or delaying the diseases that come with it. He points to the New England Centenarian study, which showed that most people reaching 100 still develop health problems, but some manage to stay healthy much longer. A major turning point, according to Topol, is understanding the role of the immune system in almost all chronic diseases. He explains that these diseases take years to develop, giving us a long window to intervene. For example, heart disease isn't just about clogged arteries, it's about inflammation in those arteries, and inflammation is controlled by the immune system. Similarly, cancer spreads because the immune system fails to stop it, and Alzheimer's is linked to inflammation in the brain. Topol highlights that we're now developing tools to carefully adjust the immune system, finding the right balance to fight disease without causing harm. Topol then discusses exciting new areas of medical research. He mentions fecal transplants, essentially transferring gut bacteria from a healthy person to someone else, which has shown success in treating serious gut infections and is now being explored for conditions like cancer and diabetes. He also talks about engineering T cells, a type of white blood cell, to fight cancer and even reverse scarring in organs like the heart. These engineered cells are showing promise in treating autoimmune diseases like lupus. He notes the role of artificial intelligence in these advancements, like using AI to discover new drugs and personalized diets. The idea is that everyone responds to food differently, and AI can help us figure out what's best for each person. Topol also looks towards the future of vaccines. Building on the success of the HPV and COVID vaccines, he envisions vaccines that could prevent cancer or boost the immune system to fight existing tumors. He also predicts a shift in cancer screening, moving away from age-based recommendations to more personalized risk assessments using AI to analyze a person's health data. This would mean fewer unnecessary screenings for people at low risk and more focused attention on those who need it. He even suggests that understanding the interplay between our genes and gut bacteria could significantly improve our ability to predict and prevent disease. Topol acknowledges challenges, including health inequities and the high cost of new treatments. He stresses that these advances must be accessible to everyone, not just the wealthy. He also points out the need for more diverse research studies, like the All of Us initiative, to ensure that findings apply to all populations. He also notes the slow pace of medical research due to bureaucratic hurdles and the reluctance of some doctors to embrace new approaches. Despite these obstacles, Topol is optimistic, fueled by the billions of dollars being invested in aging research and the rapid pace of scientific discovery. He believes we are on the verge of a revolution in health span and encourages readers to stay informed and take advantage of new opportunities as they become available. He shares his own shift in perspective, from skepticism about anti-aging drugs to believing that significantly extending healthy life is within reach. Chapter 3, Lifestyle Plus. Eric Topol begins by explaining that while new medical technologies are exciting, we shouldn't forget the power of simple, everyday habits, what he calls Lifestyle Plus. He argues that focusing on these habits can add healthy years to our lives, often without needing expensive treatments. Lifestyle Plus isn't just about diet and exercise. It includes things like air quality, exposure to harmful chemicals, financial stability, and social connections. These factors all play a big role in how we age. Topol emphasizes that much of what we know about healthy lifestyles comes from observing large groups of people over time, rather than from strict experiments. While these studies aren't perfect because people don't always accurately report their habits, they still give us valuable clues. He points out that even small changes can have a big impact on overall health, and that focusing on all-cause mortality, basically, how long people live regardless of how they die, is a useful way to measure the effectiveness of these habits. A large part of the chapter focuses on diet. Topol warns against ultra-processed foods, which are made with lots of artificial ingredients and are designed to be highly addictive. He explains that these foods aren't really food at all, and they can lead to weight gain, inflammation, and a higher risk of many diseases. He suggests focusing on whole, unprocessed foods like fruits, vegetables, and lean proteins. He also highlights the importance of fiber, which helps us feel full and keeps our digestive system healthy. He notes that even seemingly healthy foods can be problematic if they are heavily processed. Topol then moves on to exercise, stressing that it's not just about cardio. He recommends incorporating strength training and balance exercises into our routines, as these are crucial for maintaining muscle mass and preventing falls as we age. He points out that even small amounts of exercise can make a difference, and that finding activities we enjoy is key to sticking with it. He also discusses the importance of avoiding prolonged sitting, suggesting we find ways to move throughout the day. Sleep is another key component of Lifestyle Plus, according to Topol. He explains that sleep is when our brains clear out toxins and repair themselves, and that getting enough sleep is essential for both physical and mental health. He notes that sleep patterns change as we age, and that it's important to prioritize sleep hygiene, creating a relaxing bedtime routine, and making sure our bedrooms are dark, quiet, and cool. The author then dives into the dangers of environmental toxins, like air pollution, pesticides, and plastics. He explains that these toxins can accumulate in our bodies and contribute to a wide range of health problems, including cancer, heart disease, and cognitive decline. He emphasizes the need to reduce our exposure to these toxins whenever possible, and to advocate for policies that protect our environment. He specifically calls out forever chemicals like PFAS, which are found in many everyday products and don't break down in the environment. Topol doesn't ignore the importance of social connections. He explains that loneliness and social isolation can have a devastating impact on our health, increasing our risk of everything from heart disease to dementia. He suggests making an effort to stay connected with friends and family, and to participate in activities that bring us joy and a sense of community. He also acknowledges that socioeconomic factors play a huge role in health, and that addressing these inequities is crucial for improving overall health span. Finally, Topol emphasizes that the combined effect of these lifestyle plus factors is greater than the sum of their parts. He cites studies showing that people who adopt a healthy lifestyle can add years to their lives, and that even small changes can make a big difference. He believes that while new medical technologies are promising, they won't be as effective if we don't also prioritize these fundamental aspects of health. He concludes by suggesting that a focus on Lifestyle Plus is the most powerful tool we have for preventing age-related diseases and living longer, healthier lives. He believes that personalized medicine, guided by data and technology, will eventually help us tailor these habits to our individual needs, but that the foundation of good health remains the same: a healthy lifestyle. Chapter 4: Obesity and Diabetes. Eric Topol details a remarkable story of medical discovery centered around GLP-1 drugs, initially developed for diabetes, but now showing incredible promise in tackling obesity and a surprising range of age-related diseases. He begins by highlighting a frustrating delay. These helpful medicines sat undiscovered for over 20 years despite their potential. The key lies in hormones naturally produced in our gut that help control metabolism. Scientists created drugs that mimic these hormones, and after some time, developed versions that only needed to be injected once a week, making them much easier to use. Drugs like Ozempic, Wegovy, and Zepbound quickly became popular because they worked so well. The initial breakthrough came from studying the saliva of the Gila monster, which contained a long-lasting version of this hormone. The story of these drugs began with a focus on lowering blood sugar in people with diabetes, hoping to prevent heart disease and other problems. Trials showed they did help, but with only modest weight loss. It wasn't until researchers tested higher doses on people without diabetes that the real power of these drugs became clear, leading to significant weight loss. This led to the renaming of the drug from Ozempic to Wegovy, even though the actual medicine was the same, just used in a different amount. Further research led to even more potent drugs like tirzepatide, Zepbound, and now even triple receptor activators are in development, showing even greater potential for weight loss, sometimes matching the results of weight loss surgery. Topol emphasizes that these drugs aren't just about weight loss, they're about tackling the root causes of many age-related illnesses. Obesity is linked to a long list of health problems: heart disease, stroke, diabetes, Alzheimer's, and even some cancers. By addressing obesity, these drugs could potentially prevent or delay the onset of these conditions, extending a person's healthy lifespan, or health span. He points out a missed opportunity. If researchers had experimented with higher doses earlier, they might have unlocked this potential sooner, benefiting millions. The author acknowledges that measuring obesity isn't perfect. The Standard Body Mass Index, BMI, doesn't distinguish between muscle and fat and can be misleading. More accurate measures, like waist circumference or body fat percentage scans, are preferred by experts. Despite this, the numbers are alarming. Over 1 billion people worldwide are obese, and the problem is growing. Topol then delves into the science of how these drugs work, explaining that our gut produces hormones that communicate with the brain, regulating appetite and energy storage. He describes two systems: a short-term one that tells us we're full during a meal, and a long-term one that regulates our overall fat mass. These drugs essentially override the long-term system, making it easier to lose weight and keep it off. He highlights the story of Svetlana Mojsov, a scientist whose crucial contribution to the discovery of GLP-1 was initially overlooked, a common issue for women in science. He also credits Lot Bjerre-Knudsen and Richard Dimarche for pushing these drugs into obesity clinical trials. The drug's effects are still being studied, but they appear to reduce inflammation throughout the body and even impact brain function, potentially offering protection against neurodegenerative diseases like Alzheimer's and Parkinson's. Topol notes a surprising effect. People taking these drugs often shift their food preferences, craving less junk food and more healthy options. He also points out that these drugs can improve metabolic syndrome, a cluster of conditions that increase the risk of heart disease, stroke, and diabetes. However, Topol doesn't shy away from discussing the challenges. He acknowledges past failures in obesity drug development, like fen-phen and rimonabant, which had serious side effects. While GLP-1 drugs appear much safer, they do have potential side effects like nausea and gastrointestinal issues. There's also concern about muscle loss and the need for lifelong treatment. Cost and access are also major barriers, particularly for people of color and those with lower incomes. He emphasizes the importance of understanding the genetic factors that influence a person's response to these drugs. Genetic testing can help predict who will benefit most. Topol also highlights the potential for future advancements, such as pills and even vaccine-like versions of these drugs. He believes that artificial intelligence, AI, will play a crucial role in accelerating the development of even more effective and targeted therapies. He points to the recent breakthroughs in AI's ability to predict protein structures as a game changer, potentially allowing scientists to design new drugs with greater precision and speed. Topol concludes with a hopeful outlook, suggesting that these drugs, combined with advances in AI, could revolutionize the prevention and treatment of age-related diseases. He draws a parallel to statins, which have significantly reduced the incidence of heart disease, but acknowledges that even with these advancements, lifestyle factors like diet and exercise remain important. He believes that understanding the complex interplay between genetics, hormones, and lifestyle will be key to unlocking the secrets of healthy aging. Chapter 5: Cardiovascular Disease. Eric Topol begins by noting a surprising trend. Despite expectations, heart disease remains the leading cause of death globally, even with advancements in cardiology. He shares that while progress was made in reducing heart disease deaths for many years, since 2019, numbers have actually been increasing, now exceeding cancer deaths by about 17%. This is happening despite well-known ways to prevent heart problems, like people quitting smoking and taking statins. Topol emphasizes that heart disease is remarkably preventable. 80 to 90% of cases could be avoided with lifestyle changes. The core of the problem, according to Topol, lies in atherosclerosis, the hardening of the arteries. He explains it like oatmeal left in a dirty pan, a buildup of fatty material, called plaque, that narrows the arteries. This plaque forms over decades, caused by things like high cholesterol and inflammation. He points out that this process can happen suddenly, causing a heart attack or slowly limiting blood flow. Topol stresses that the earlier we address the things that damage artery walls, smoking, high blood pressure, diabetes, the better. He highlights that this disease often starts developing very early in life, even in teenagers. Topol then dives into the exciting world of new medical tools for predicting and preventing heart disease. He discusses how scientists are now looking beyond traditional risk factors like cholesterol and blood pressure. They're exploring omic tests looking at a person's genes, polygenic risk scores, gut bacteria, gut microbiome score, and proteins proteomic score to get a more complete picture of their risk. For example, a polygenic risk score can tell someone how likely they are to develop heart disease based on their genes, and this information can help doctors decide if someone should start taking statins earlier in life. He explains that these tests are becoming more available, even through companies like 23andMe. The author details how inflammation plays a huge role in heart disease. He describes trials with drugs like colchicine and canakinumab, which reduce inflammation, and showed promising results in lowering the risk of heart attacks and strokes. While these drugs aren't widely used yet, they demonstrate the potential of targeting inflammation to prevent heart problems. He also mentions new imaging techniques, like AI-powered analysis of CT scans, that can detect inflammation in the arteries even before there are blockages. Topol emphasizes that knowing your risk is key. He envisions a future where everyone gets a comprehensive risk assessment early in life, combining traditional factors with these new omic tests. This would allow doctors to personalize prevention strategies, like recommending lifestyle changes, starting medications earlier, or closely monitoring patients. He notes that even simple things like a gut microbiome analysis could provide valuable information. He then shifts focus to atrial fibrillation, an irregular heartbeat that increases the risk of stroke. Like heart disease, atrial fibrillation is common, especially with age, and often goes undiagnosed. Topol points out that many of the same risk factors apply obesity, high blood pressure, diabetes, but also highlights unique factors like sleep apnea and even gum disease. He again stresses the power of genetic testing, explaining that a polygenic risk score can predict someone's likelihood of developing this condition. Topol concludes by reiterating that we have the tools to prevent these age-related heart conditions, but we aren't using them enough. He believes that by combining advanced technology, personalized risk assessments, and proactive interventions, we can significantly extend health span, the number of years people live in good health. He draws a parallel to cancer, suggesting that similar opportunities for prevention exist there as well, setting the stage for the next chapter. Chapter 6: Cancer. Eric Topol argues that our approach to cancer is stuck in the past, despite huge advances in understanding how the disease works. He believes that by 2050, even more people will die from cancer, unless we start using all the new tools and knowledge we have. He points out that nearly half of us will get cancer at some point, so tackling it is key to living longer, healthier lives. Topol feels the war on cancer metaphor is unhelpful. It's not about brute force, but about smart use of what we already know. He emphasizes 5 important areas: lifestyle, understanding our genes and bodies, Genomics, artificial intelligence, AI, cells, and new drugs and vaccines. Topol explains that cancer starts in a few different ways. One idea is that changes or mutations happen in our genes, making them grow out of control. Another is that damage to tissues and a weak immune system can lead to cancer. A third idea is simply bad luck, random mistakes when cells copy themselves. As we age, more mistakes happen in our cells, increasing the risk. However, Topol highlights that our bodies have defenses, and many of these mistakes don't lead to cancer. He introduces the concept of driver genes, genes that, when mutated, are more likely to cause cancer to develop. A major breakthrough Topol discusses is spatial biology. This is like creating a 3D map of a tumor, showing how cancer cells grow and change over time. Scientists can now look at thousands or even millions of cells within a tumor, analyzing their DNA, RNA, proteins, and other important details. This detailed mapping requires powerful AI tools. This helps us understand the tumor microenvironment, everything around the cancer cells, like immune cells and blood vessels, and how the cancer spreads. Previously, doctors would just say a tumor was heterogeneous, meaning not uniform. Now, they can see the history of the tumor, almost like a cellular time machine. Topol notes that cancer often takes years to develop. He gives examples of women who had early signs of cancer decades before they were actually diagnosed. This is a crucial insight because it means we might be able to detect and treat cancer much earlier, even before it causes symptoms. He stresses that preventing disease years before it fully develops is key to extending our healthy years. Metastasis, when cancer spreads to other parts of the body, is what usually kills people. He explains that cancer cells are very opportunistic, even becoming more active while we sleep. They can also hijack our nervous system and blood vessels to help them grow and spread. The author points out that treatments are improving, with examples like antibody-drug conjugates, which deliver chemotherapy directly to cancer cells, and immunotherapies, which boost our immune system to fight cancer. He also discusses exciting advances in engineering cells, like CAR-T therapy, to target and destroy cancer cells. However, Topol is critical of the one-size-fits-all approach to cancer screening. Current guidelines are based mostly on age, and he argues that this isn't effective. He believes we need to identify people at high risk and focus screening efforts on them. Topol champions the use of AI to analyze medical records, scans, and genetic data to predict who is likely to develop cancer. He discusses polygenic risk scores, which can estimate a person's risk based on their genes, and whole genome sequencing, which looks at all of a person's DNA. He also mentions new blood tests that can detect early signs of cancer. However, he cautions that these tests are not perfect and need further research. He criticizes the marketing of expensive, unproven tests like whole-body MRIs. Topol emphasizes the importance of prevention. He notes that while cancer deaths have decreased, new cases are rising, especially in young people. He suggests that lifestyle factors, like diet and environmental exposures, may be playing a role. He also points out that we often miss opportunities to prevent cancer because we don't use all the tools we have. He uses the example of aspirin, once recommended for cancer prevention, but now shown to have risks. He also discusses the success of vaccines, like the HPV vaccine, in preventing cervical cancer. Topol concludes that we need a complete overhaul of our approach to cancer, from screening and diagnosis to treatment and prevention. He believes that by using all the new tools and knowledge we have, we can significantly improve people's health and extend their lifespans. He urges a move towards personalized medicine, tailoring treatments to each individual's unique characteristics. He acknowledges that there are challenges, such as data privacy and the cost of new technologies, but believes that the potential benefits are enormous. He ends by suggesting that the future of health span expansion depends on our ability to get cancer under control. Chapter 7, Neurodegeneration. Eric Topol dives deep into how we're starting to understand and potentially fight off brain diseases like Alzheimer's and Parkinson's, focusing on preventing them rather than just treating symptoms. For a long time, scientists thought the brain was protected from the body's immune system, but now we know that's not true. The brain actually has its own immune system and a way to clear out waste, kind of like a plumbing system called the glymphatic system. This system is important because problems with it can lead to these diseases. Topol explains that these diseases aren't just about what happens in the brain. They involve the immune system, genetics, lifestyle, and even the tiny organisms living in our gut. Alzheimer's, for example, is linked to two proteins, amyloid and tau, that build up and cause problems. But it's not as simple as just getting rid of those proteins. Scientists are realizing that many things contribute, including how well our brains clear waste, how our immune system responds, and even our cholesterol levels. A big step forward has been a blood test that can detect signs of Alzheimer's decades before symptoms appear, using a marker called p-tau217. This is huge because it gives us a chance to intervene early. The APOE4 gene is a major risk factor for Alzheimer's, but it's not a guarantee. Topol points out that even people with this gene can stay healthy, and scientists are discovering other genes that might protect the brain. He emphasizes that lifestyle plays a big role. Things like exercise, a healthy diet like the Mediterranean diet, good sleep, and social interaction can all help keep the brain healthy. He notes that walking around 9,800 steps a day is linked to better brain health. Topol also discusses the gut microbiome, the community of bacteria living in our intestines, and how it can affect the brain. Studies show that people with Alzheimer's have different gut bacteria than healthy people, and that changing the gut microbiome might even help prevent the disease. He's cautious about jumping to conclusions, but the connection is becoming clearer. He also addresses the recent approval of drugs like lecanemab and donanemab, which aim to clear amyloid plaques from the brain. While these drugs show some promise, they come with risks and aren't a perfect solution. Turning to Parkinson's disease, Topol highlights the role of a protein called alpha-synuclein. Like amyloid in Alzheimer's, this protein can build up and cause problems. Interestingly, Parkinson's often starts with gut issues, and there's a connection between the gut and the brain. New research is looking at ways to slow down the disease, including drugs that target alpha-synuclein and even fecal transplants, transferring gut bacteria from a healthy person to someone with Parkinson's. He also mentions the potential of GLP-1 drugs, originally used for diabetes, to help protect the brain. Topol is excited about the potential of using technology to predict and prevent these diseases. He talks about using AI to analyze brain scans, genetic information, and lifestyle factors to identify people at high risk. This allows for personalized interventions, like recommending specific lifestyle changes or starting preventative treatments. He also discusses the possibility of using gene therapy to correct genetic defects that increase the risk of these diseases. He highlights research into factors found in young blood that seem to rejuvenate the brain, like a protein called platelet factor 4. Finally, Topol stresses that preventing these diseases is about more than just medicine. It's about taking care of our overall health, addressing environmental factors like air pollution, and staying mentally and socially active. He believes that by combining these approaches, we can significantly reduce the burden of neurodegenerative diseases and help people live longer, healthier lives. He cautions against unproven supplements and emphasizes the need for rigorous scientific research to find effective solutions. He envisions a future where we can identify risk early, intervene proactively, and keep our brains young for longer. Chapter 8, Curing Rare Diseases. Eric Topol begins by explaining a surprising connection. The way we're learning to cure rare diseases will actually help us fight common illnesses like heart disease and aging. He believes that breakthroughs in understanding and editing our genes, called genome editing, are the most important advances in science happening right now. While it might not be happening for everyone today, Topol suggests that children and grandchildren might experience some form of gene editing during their lives. The author points out that even though each rare disease affects a small number of people, when you add them all up, they impact a huge number of individuals, over 400 million worldwide. Most of these diseases, over 80%, are caused by problems in our genes. Different organizations define rare differently, but the key takeaway is that these diseases are more common than people realize. Topol uses the example of a very rare form of high cholesterol, familial hypercholesterolemia, to illustrate his point. People with this condition have extremely high cholesterol levels and are at risk of early heart disease. Currently, they need lifelong medication, but gene editing offers a potential one-time fix. Topol details exciting progress in gene editing, specifically with a tool called CRISPR. He explains that CRISPR was originally discovered as a defense system used by bacteria to fight viruses. Scientists realized they could use this system to precisely edit DNA. It's like having molecular scissors that can cut and paste genes. Early versions of CRISPR, called CRISPR-1, were good at disrupting genes, but not at fixing them. The newer versions, CRISPR-2, including base editing and prime editing, are much more precise and can actually correct genetic errors. Topol uses the analogy of a word processor to explain prime editing. It can change individual letters in the genetic code or even add or delete small sections. The author highlights the recent approval of a CRISPR-based therapy called Casgevy for sickle cell anemia and beta thalassemia. These are genetic blood disorders that cause severe pain and require frequent blood transfusions. Casgevy offers a potential cure, but the treatment is complex and involves removing cells from the patient, editing them, and then putting them back in. Topol believes the future of gene editing lies in delivering these tools directly into the body with a single injection, like the approach being tested for high cholesterol. Topol then clarifies the difference between gene editing and gene therapy. He uses a car analogy. Gene therapy is like adding a spare tire to a car, hoping it will work, while gene editing is like fixing the flat tire. Gene therapy adds a new gene, while gene editing corrects a faulty one. While gene therapy has been around longer and has already been approved for several diseases, it has limitations. Gene editing offers the potential for more precise and lasting cures. The author discusses the exciting possibilities of one-shot genome editing, where a single treatment can provide long-term benefits. He describes studies in animals showing success in treating conditions like progeria, a disease of accelerated aging, hearing loss, and Alzheimer's disease. He also mentions clinical trials for hereditary amyloidosis and hereditary angioedema, where early results are promising. Topol emphasizes that delivering these gene-editing tools to the right cells in the body is a major challenge, and scientists are working on improving nanoparticles and virus-like particles to overcome this hurdle. Topol addresses the ethical concerns surrounding gene editing, particularly the case of the Chinese scientist who edited the genes of human embryos. He stresses that germline editing changes that can be passed down to future generations is not yet ready for use and requires careful consideration. He also acknowledges the high cost of these therapies and the need to ensure equitable access for all patients. Finally, Topol emphasizes the importance of genomic sequencing, reading a person's entire genetic code. The cost of sequencing has dropped dramatically, making it more accessible. He describes how sequencing can be used to diagnose rare diseases, identify genetic risks, and personalize treatment plans. He highlights the growing trend of newborn screening, where babies are sequenced to identify potential health problems early on. Topol believes that widespread genomic sequencing will revolutionize healthcare. allowing us to prevent and treat diseases more effectively. Chapter 9, Controlling Our Immune System. Eric Topol explores how scientists are learning to control the immune system, not just boost it, which is a huge step forward in fighting age-related diseases. He points out that autoimmune diseases, where the body attacks itself, affect a lot of people, over 10% of the population, and current treatments aren't great because they weaken the immune system overall, making people vulnerable to infections. For a long time, fixing this problem seemed impossible, but now, thanks to a better understanding of how the immune system works, things are changing. Topol explains that the immune system is incredibly complex, with trillions of cells and antibodies working to protect us. It has two main parts: the innate system, which is a quick, general defense, and the adaptive system, which learns and remembers specific threats. He uses the example of how our noses release interferons when we get a virus, showing the innate system in action. The adaptive system is like a specialized army, with B cells making antibodies and T cells attacking invaders. What's amazing is that these cells can remember past threats, allowing for a faster response next time. The author highlights exciting new strategies to reprogram the immune system to be more tolerant, meaning it won't attack the body's own tissues. This could lead to cures for diseases like lupus, type 1 diabetes, and rheumatoid arthritis. He mentions a breakthrough in 2024 where scientists discovered a brain circuit that can dial up or down the immune response, offering a potential way to control inflammation. This discovery, made by studying mice, showed that activating certain brainstem neurons could reduce inflammation by 70%. Topol emphasizes that age plays a big role in immune function. As we get older, our immune systems become less effective, a process called immunosenescence. This means it takes longer to respond to threats, and we have fewer immune cells. He introduces the idea of inflammaging, a low-grade, chronic inflammation that comes with age. However, he notes that some people age better than others, and scientists are working to understand why. They've even developed an immune age score that can predict how long someone might live, based on the health of their immune system. A major focus of the chapter is restoring immune tolerance. The goal is to teach the immune system to ignore the body's own tissues. Topol discusses several promising approaches, including nanoparticles that bait immune cells into becoming regulatory cells, TREGs, that suppress autoimmune attacks. He describes how a company called Parvus Therapeutics is using these nanoparticles to treat autoimmune hepatitis. Another strategy involves attaching sugar molecules to antigens, which helps the liver teach immune cells not to attack the body. The author also dives into the exciting world of cell engineering, where scientists modify immune cells to fight disease. He highlights a groundbreaking treatment for autoimmune diseases where engineered T cells are used to wipe out all B cells, effectively resetting the immune system. While this approach is drastic, it has shown remarkable results in patients with lupus and other conditions. He also discusses the potential of CAR T cell therapy, where T cells are engineered to target specific immune cells involved in autoimmune attacks. Topol points out the importance of the gut microbiome, the trillions of bacteria living in our intestines, in regulating the immune system. He explains that an imbalance in gut bacteria can contribute to autoimmune diseases. He cites a study showing that a specific probiotic blend improved symptoms in people with long COVID, a condition characterized by a dysregulated immune system. Manipulating the gut microbiome through diet, probiotics, or fecal transplants could be a powerful way to prevent and treat autoimmune diseases. Finally, Topol discusses the potential of genome editing to prevent organ rejection in transplants. Scientists are using CRISPR technology to modify pig organs, making them less likely to be attacked by the human immune system. This could solve the critical shortage of donor organs and save countless lives. He concludes by emphasizing that controlling the immune system is a key to preventing age-related diseases and extending health span, the period of life spent in good health. He envisions a future where we can rejuvenate our immune cells and prevent the decline in immune function that comes with age. Chapter 10: Defeating Infectious Agents. Eric Topol explores how far we've come in fighting infections and how this progress can help us live longer, healthier lives, especially as we get older. He begins by remembering the scary early days of COVID-19, when hospitals were overwhelmed and people were very afraid. What's amazing, Topol points out, is how quickly a vaccine was developed, in just 10 months. This was much faster than usual, because scientists had been working for decades on mRNA technology, which allows our bodies to make their own vaccines. It's like giving your body the instructions to build a defense system against a virus. The success with COVID vaccines showed us how powerful new tools can be. But Topol emphasizes that it wasn't just about the mRNA technology. It was also about understanding the virus itself, specifically a protein called the spike protein, and figuring out how to make the vaccine trigger a strong immune response. Scientists had actually been doing research on similar proteins for years, unknowingly preparing for this moment. This highlights how important basic scientific research is, even if we don't know exactly where it will lead. He notes that Operation Warp Speed, a government program, helped speed things up by funding vaccine production even before it was clear which vaccines would work. This was a risky move, but it paid off. Topol then broadens the discussion to other infectious diseases. He points to the recent success in developing a vaccine for RSV, a common virus that can be dangerous for babies and older adults. This vaccine, like the COVID vaccine, was designed using a detailed understanding of the virus's structure. He explains that a key breakthrough came from scientists Catalin Carrico and Drew Weissman, who discovered a way to prevent mRNA from causing inflammation in the body. This discovery earned them a Nobel Prize and was crucial for the development of the mRNA vaccines. The author also discusses the challenges of creating a universal flu vaccine. The flu virus changes constantly, making it hard for vaccines to keep up. However, scientists are now using mRNA technology to create vaccines that target multiple strains of the flu, hoping to provide broader and longer-lasting protection. He also touches on the progress being made in fighting hepatitis C, a liver disease, and diseases like malaria, tuberculosis, and HIV, all of which are being targeted with new mRNA-based approaches. Topol doesn't shy away from discussing the limitations of current vaccines. The COVID vaccines, while highly effective initially, became less so as the virus mutated. This led to the need for booster shots. He explains that the goal is to create vaccines that are more durable and can protect against a wider range of variants. Scientists are exploring ways to improve mRNA vaccines, such as using self-amplifying RNA and better nanoparticles to deliver the mRNA into cells. Nanoparticles are tiny bubbles of fat that help protect the mRNA and get it inside our cells. He then shifts focus to the growing problem of antibiotic resistance. Bacteria are becoming increasingly resistant to antibiotics, making infections harder to treat. Topol highlights the need for new antibiotics and innovative approaches, such as using viruses that infect bacteria, called bacteriophages, to kill them. He also emphasizes the power of artificial intelligence, AI, in discovering new drugs and diagnosing infections quickly. AI can analyze huge amounts of data to identify potential drug candidates and detect infections before they become serious. He points out that rapid sequencing of pathogens, a process called metagenomics, can quickly identify the cause of an infection and guide treatment decisions. Topol also discusses the potential for vaccines to prevent diseases that were previously thought to be non-infectious, like multiple sclerosis, MS. Research suggests that the Epstein-Barr virus, which causes mononucleosis, may play a role in the development of MS. This opens the door to developing a vaccine that could prevent MS by preventing Epstein-Barr infection. He also mentions the remarkable success of the HPV vaccine in preventing cervical cancer, demonstrating the power of vaccines to prevent cancer caused by viruses. Finally, Topol stresses the importance of addressing social and political factors that hinder progress in fighting infectious diseases. He notes that anti-science movements and vaccine hesitancy can undermine public health efforts. He argues that we need to invest in research, promote equitable access to vaccines, and combat misinformation to protect ourselves from infectious diseases and extend our lifespans. He concludes that while science is making incredible advances, overcoming these challenges will be crucial for a healthier future. Chapter 11: Promoting Mental Health. Eric Topol explores the strong connection between our mental and physical health, arguing that taking care of both is key to living a longer, healthier life. He points out that stress, for example, isn't just a feeling. It can actually make illnesses like cancer worse. With over 50 million Americans struggling with mental health, and many unable to get the help they need due to a shortage of professionals, Topol emphasizes the need for new solutions. He believes we can't simply rely on traditional medical care to solve this problem. Topol highlights something surprisingly simple yet powerful: spending time in nature. He explains that being outdoors, whether in parks, forests, or by the beach, can lower blood pressure, improve sleep, boost our immune system, and even reduce feelings of stress and sadness. He shares studies showing that people who spend more than 2 hours a week in nature tend to be healthier and happier. He also mentions a Nature Score app that shows how much access to green spaces people have in different areas, revealing that those with less money often have less access to these beneficial environments. This points to a problem of fairness in health. The author then turns to the power of music. Topol describes how listening to or even making music can have a positive effect on our brains and bodies, reducing anxiety, stress, and pain. He explains that the National Institutes of Health is actively researching this, looking at how music affects brain activity. He notes that even singing in a group can be more effective than singing alone, and that enjoying music, whatever your taste, is a simple way to support your mental well-being. Topol then shifts focus to everyday lifestyle choices. He stresses the importance of sleep, explaining that a good night's rest improves everything from exercise performance to mood and even helps clear waste from the brain. He points out that sleep problems are common, especially as we age, and can increase the risk of dementia. He suggests simple ways to improve sleep, like regular exercise, a consistent bedtime, and avoiding screens before bed. He also discusses digital cognitive behavioral therapy, DCBT, apps as a helpful tool for improving sleep patterns. Physical activity is another key component, according to Topol. He shares research showing that exercise, even walking or yoga, is often more effective at reducing depression than medication. He explains that exercise not only improves mood, but also reduces the risk of heart disease and other health problems. He emphasizes that even small amounts of activity can make a difference. Topol also addresses the growing problem of loneliness and social isolation. He explains that humans are wired to connect with others, and that feeling alone can have serious consequences for our health, increasing the risk of depression, anxiety, and even premature death. He shares the story of a 98-year-old woman who found renewed happiness by joining a community of artists, highlighting the importance of social connections. He also discusses the surprising power of human touch, explaining that even a simple hug can have positive effects on our health. The author then dives into the connection between what we eat and how we feel. He explains that the gut microbiome, the community of bacteria in our digestive system, plays a crucial role in mental health. He shares research showing that a healthy diet, rich in fiber and low in processed foods, can reduce stress and improve mood. He also mentions the potential of new drugs that target inflammation in the brain, offering hope for more effective treatments for mental illness. Finally, Topol explores the role of technology in mental health care. He discusses wearable sensors that can track things like sleep, activity levels, and even facial expressions to provide insights into our mental state. He also examines the use of AI chatbots, like Wobot, which can provide support and guidance. While acknowledging the risks of relying too much on technology, he believes that these tools have the potential to make mental health care more accessible and affordable. He cautions that privacy and safety are important concerns, and that these technologies need to be carefully evaluated. Topol concludes by emphasizing that taking care of our mental health is essential for healthy aging, and that a combination of lifestyle changes, technology, and, when necessary, medication can help us live longer, happier lives. Chapter 12, Changing Aging. Eric Topol begins by painting a picture of the booming longevity industry, filled with expensive clinics and promises of extending life. He points out that while there's a lot of excitement and a lot of money being invested by people like Jeff Bezos, much of it is based on hype rather than solid science. Topol emphasizes that while we are living longer, we aren't necessarily living healthier longer. In fact, people are spending more years with multiple chronic diseases, meaning a small increase in lifespan doesn't necessarily translate to a better quality of life. He highlights that the gap between how long we live and how long we live well is growing, and closing that gap is the real challenge. Topol dives into the biology of aging, explaining it as a buildup of damage to our cells over time. He details 12 key hallmarks of aging, like DNA instability, the shortening of protective caps on our chromosomes called telomeres, and the buildup of damaged proteins. These hallmarks aren't isolated events, they all connect and influence each other. Scientists are studying these hallmarks to find ways to slow down or even reverse the aging process. He notes that understanding these processes is progressing, but it's still early days. The author then discusses the idea of biological age versus chronological age. Our chronological age is simply how many years we've been alive, but our biological age reflects how well our bodies are functioning. Scientists are developing clocks using things like DNA methylation patterns to measure biological age. These clocks can potentially tell us if we're aging faster or slower than expected. However, Topol cautions that these clocks are still being refined and aren't yet ready for widespread use in guiding personal health decisions. He also introduces the concept of organ clocks, recognizing that different organs age at different rates, and that understanding these individual patterns could lead to more personalized interventions. Topol then explores how we might actually prevent age-related diseases. He emphasizes the importance of lifestyle factors, diet, exercise, and sleep, and how a healthy lifestyle can significantly impact lifespan and health span. He points to studies showing that even moderate changes, like regular physical activity, can have a big effect. He also discusses the potential of calorie restriction, though its effectiveness in humans is still debated. He then moves into more experimental interventions, like drugs that target specific aging processes. He discusses rapamycin, a drug that shows promise in animal studies but has potential side effects, and senolytics, drugs designed to clear out senescent cells old, damaged cells that contribute to inflammation and disease. The author highlights the exciting research around epigenetic reprogramming, where scientists are trying to reset cells to a younger state. This work, pioneered by researchers like Juan Carlos Izpasua Belmont, involves using special factors to erase the epigenetic marks that accumulate with age. While promising, this approach is still in its early stages and carries the risk of causing cancer. Topol also discusses the potential of young blood transfusions, or more realistically, identifying the specific factors in young blood that promote health. He notes that the field is moving towards identifying specific molecules and pathways that can be targeted with drugs, rather than relying on broad-spectrum approaches. Finally, Topol touches on the importance of inflammation in aging and the potential of anti-inflammatory drugs to slow down the process. He mentions the GLP-1 drugs, originally developed for diabetes, as a promising example. He concludes by emphasizing that while there's a lot of hype surrounding anti-aging interventions, there's also real scientific progress being made. He suggests that a personalized approach, tailored to an individual's specific aging patterns and risk factors, is the most likely path to extending health span and improving quality of life as we age. He stresses that while the goal of dramatically extending lifespan is ambitious, the more realistic and achievable goal is to help people live healthier, more vibrant lives for the years they have. Chapter 13, The Path Forward. Eric Topol begins by reflecting on two individuals he knows: a woman who seems naturally healthy for her age, and a man who has relied on modern medicine to overcome several health challenges. He uses them to illustrate that while some people are simply lucky when it comes to aging, others benefit greatly from medical advancements. However, Topol points out that even with excellent care, we haven't yet figured out how to truly stop or reverse aging. It's a very difficult thing to prove, as testing these ideas would require long-term studies with many people, which are expensive and hard to conduct. Instead, scientists are using clues, like changes in our cells, to see if interventions are working, but these clues don't always tell us about overall health. A big challenge in slowing aging, Topol explains, is that many of the things that make us age also contribute to cancer. Things like damaged cells and inflammation are part of both processes. This means that treatments aimed at slowing aging could potentially increase the risk of cancer, and scientists need to be very careful. For example, trying to get rid of old, damaged cells might sound good, but it could accidentally harm healthy cells or even make things worse. Boosting our body's cleaning system could also help cancer cells survive. It's a delicate balance. Topol also notes that aging isn't currently considered a disease by the organizations that approve new medicines. This makes it harder to get funding for research into anti-aging treatments. He compares this to obesity, which wasn't seen as a disease until new drugs became available that showed how serious it was. He believes that as we learn more, aging might eventually be recognized as a condition that can be treated. However, he cautions that simply extending lifespan doesn't necessarily mean people will be healthier for longer. He uses a poem about a horse-drawn carriage to illustrate this point. Things can fall apart suddenly, even after a long period of seeming stability. The author acknowledges the excitement around ideas like longevity escape velocity, the idea that medical advances will eventually outpace the aging process, but he remains skeptical. He believes that the more realistic goal is to focus on preventing age-related diseases and keeping our organs healthy for as long as possible. This is where he sees the biggest potential for progress in the near future. Topol is optimistic about the power of new technologies, like artificial intelligence, AI, to help us predict and prevent diseases. He explains that many age-related diseases develop slowly over decades, giving us time to intervene. By using biomarkers, measurable signs of disease, genetic information, and AI, we can identify people at risk and create personalized prevention plans. This could involve lifestyle changes, regular checkups, and targeted treatments. He believes this approach is more achievable than trying to slow aging as a whole. He highlights the importance of understanding our immune system. Topol believes that our immune system isn't simply good or bad, but changes over time. He envisions a future where we can regularly assess the health of our immune system, an immunome, to predict our risk of various diseases and tailor treatments to boost our defenses. He shares an example of a new test that can measure our exposure to hundreds of viruses and identify autoimmune antibodies. Topol emphasizes that we've been mostly reactive in medicine, treating diseases after they develop. He believes we're on the cusp of a new era of primary prevention, stopping diseases before they even start. However, he stresses that two major obstacles stand in the way: health inequality and our failure to address environmental factors that harm our health. He argues that everyone should have access to these new technologies, not just the wealthy, and that we need to tackle issues like pollution and unhealthy foods to truly improve health span. He concludes with a hopeful outlook, believing that we are entering an extraordinary time in life science and that preventing age-related diseases is within our reach. And that brings us to the end of our summary of this book. I hope you found it insightful and valuable. If you enjoyed this video, hit like and subscribe for more. Your support helps us bring you more great content. Thanks for watching.